Ultimately, as we build national health information systems, we must remember that community health workers are at the grassroots. Digital health should empower them to make safe decisions and connect their work to the broader health system so that no one is left behind in their pursuit of universal healthcare.
Good day, everyone, and welcome to the 18th session of UP Manila SILab webinar series IOL 2025. Today, we bring you our fifth community-led webinar session, IOL 201 Community Connect Decision Support in Primary Healthcare, the Community Health Assessment Program Philippines Experience. Please join me in welcoming very active Dr. Jaime Punzalan.
A rainy morning in Zamboanga, and I hope you're doing fine po in your respective places. With McMaster University, Department of Family Medicine, and Ateneo de Zamboanga University School of Medicine, I'll be sharing our experiences and insights on decision support in primary healthcare, focusing on our journey with Community Health Assessment Program in the Philippines. And PHC is a critical because it doesn't just treat illnesses, it focuses on health promotion, prevention, and rehabilitation. It's the best strategy for closing gaps in access, especially in rural and underserved areas, which is very relevant to our context in the Philippines. The Philippine Universal Healthcare recognizes PHC as the health system's foundation. PCPM encompasses barangay health stations, rural health units, city health offices, and occasionally contracted services such as diagnostics and telehealth. Its role is to ensure equitable and accessible services across the communities. Despite these structures, significant barriers exist in low-resource settings. Geographic isolation, we also face a shortage of trained healthcare workers, high out-of-pocket expenses, as well as poor infrastructure and connectivity. These gaps translate to real impacts. Delays in diagnosis and treatment, preventable diseases remain unchecked, limited support for community health workers, and widening health inequities. So who often bridges these gaps? It is often bridged by our barangay health workers. They are the first point of contact in the community. However, BHWs face significant challenges. Many have limited training, lack resources, and deal with overwhelming workloads. They also often rely on paper records, which are time-consuming, prone to errors, and disconnected from higher-level health systems. This is where decision support tools come in. These are digital apps or systems that guide health workers in delivering safe, standardized care based on protocols and best practices. Examples include risk assessment for hypertension and diabetes, follow-up visit reminders, and automatic risk score calculations. The Community Health Assessment Program in the Philippines is a program implemented in Zamboanga Peninsula that aims to bridge gaps in delivery of care for non-communicable diseases, specifically hypertension and diabetes mellitus. CHAPP is based on the Cardiovascular Health Awareness Program from Canada. It was proven effective and cost-efficient, especially in low-resource areas. We adopted this program for the Philippines as CHAPP. This decision support provided structured guidance on referrals, health education for diet, exercise, and weight loss, standardizing care delivery at the community level. It was a 6-month, 26 community parallel cluster RCT that took place from June 2018 to May 2019. The main element of CHAPP intervention is the CHAPP sessions. It is held by monthly walk-in sessions in rotating barangay locations. Our primary outcome was a difference in HbA1c between intervention and control groups after 6 months. We also track other outcomes. There were 3 different types of data collection. Random community sampling was conducted with residents aged 40 and above. There was CHAPP session data from community residents who attended at least one CHAPP session. There were interviews, focus group discussions from BHWs and other staff who facilitated CHAPP session, including nurses and midwives. Notably, significant decreases were seen in systolic blood pressure by the second visit and body weight by the third visit. For the RCT group, there was a significant difference in the systolic blood pressure between intervention and control groups. This is a brief overview of the qualitative results from interviews and focus groups discussion with BHWs and other implementers of CHAPP sessions. And the main challenge that CHAPP implementers described was the lack of availability of medications, doctors, and supplies in the region. With the positive results from a randomized controlled trial, especially in rural areas, we moved forward with the scale-up implementation. This was held from 2020 to 2025. The goal was to bring CHAPP to more communities, implemented in 3 provinces of Zamboanga Peninsula, and it covered about 300 barangays, trained about 1,500 barangay health workers, and reached around 20,000 participants in Zamboanga Peninsula region. And BHWs felt more confident in health education and referrals. Nurses and midwives integrated CHAPP into existing NCD risk assessment. Local health officers noted better health-seeking behavior and used data for planning and budgeting. Our key takeaway These tools guide safe clinical pathways, support health workers with limited training, and generate data that feeds into the broader health systems. This slide summarizes the critical role of decision support tools in connecting the work done by the barangay health workers, such as those in CHAPP. They create a feedback loop between frontline services and the health system, enabling evidence-based service and resource allocation. For the digital health to truly integrate into the health system, we need standards and interoperability. Ultimately, as we build national health information systems, we must remember that community health workers are at the grassroots. Digital health should empower them to make safe decisions and connect their work to the broader health system so that no one is left behind in their pursuit of universal healthcare.
Was CHAPP ever combined with other health assessment programs for VDOH like PhilPen or Purok Kalusugan? And also, I think related to that, does CHAPP have the potential to be institutionalized as part of UHC implementation po in the Philippines?
Thank you for that question, because actually, after the RCT as well as the scale implementation, we're able to provide evidence that the CHAPP model actually provides benefits, not just for the hypertensive and diabetic individuals, but also for our barangay health workers as well as the local health systems. So our goal is to lobby to the DOH on how we can implement CHAPP and institutionalize it in the health programs of the DOH. So basically, we're planning with the Zamboanga Peninsula Center for Health Development on how we can incorporate CHAPP or how we can incorporate or collaborate CHAPP with PhilPen. Because some of the implementation sites perform or conduct the PhilPen and the CHAPP risk assessments simultaneously, so that it will be more efficient for them in terms of gathering data from our individuals. I would like to acknowledge first the presence of our co-primary investigators, Dr. Ricardo Angeles. He's a Filipino, part of the Canada team from McMaster University.
What we measured was regression models between intervention and control, and also BP over time. Both was in favor of the intervention group. So nag-decrease ang blood pressure over time, and also there was a significant difference between the intervention and the control group. Yeah, we're glad that it's helpful yung sa projects namin, and we're also very happy right now with our preliminary analysis, because everything in the RCT, when we scaled it up, it retained. So it seems like the project is successful, and we're very happy that the BHWs was able to implement the program.
Alright, so that brings us to the end of today's session of IOL 201 Community Connect. Let's all continue to connect, collaborate, and learn together. See you next week. Magandang gabi, hasta umaga. Bye!